Hello and welcome everyone. Today we are discussing about hcg, that is human chorionic gonadotropin hormone. hcg is a chemical created by trophoblast tissue typically found in early embryos and which will eventually be part of the placenta. Measuring hcg level can be helpful in identifying a normal pregnancy, pathological pregnancy, and can also be useful following an aborted pregnancy. It is also elevated in choriocarcinoma and extrauterine malignancies. Human chorionic gonadotropin is a hormone produced primarily by syncytial trophoblast cells of placenta. Smaller amount of hcg are also produced in pituitary gland, liver, and the colon. Certain malignancy can also produce either hcg or hcg related hormone, such as trophoblastic cancers like hydatidiform mole, choriocarcinoma, germ cell tumors. The hormone itself is a glycoprotein composed of two subunits, alpha and beta subunits. Now let's learn little bit about the testing procedure. The samples required to test hcg levels, they are urine and serum. In the urine, hcg levels are detected which are more than 20 milli-international unit per ml. For the urine test, the freshly voided morning urine sample is preferred, and the test is done by lateral flow method. The test procedure is shown in this picture. In the rapid card, in the sample section, add 3 drops of urine. Wait for 5 minutes and check for appearance of the band. If the test band appears along with the control band, then it is positive test result. And if the test band is negative, not appear with control band present, then it is a negative test result. There are certain limitations of urine hcg tests. In the urine, false positive can occur due to blood or protein in the urine, or due to human error in result interpretation, or ectopic production of hcg, or exogenous hcg given, or certain drugs like aspirin, carbamazepine, methadone, high urinary pH, and seminal fluid. The certain situation can lead to false negative in the urinary test. They are early measurement after conception, dilute urine specimen, and a hook effect. We are discussing afterward what is hook effect. The serum test for hcg are immunometric assays. This table shows the approximate hcg levels for a single intrauterine pregnancy according to weeks of gestation. Beta-hcg rises up to 12 weeks of pregnancy. After that, it starts to decline. This number should be used as a guide only. The levels may rise differently in different individuals. In normal pregnancy, hcg can be detected as early as 7 to 10 days after conception. Total hcg level of greater than 1 lakh milli-international unit per ml in early pregnancy is highly suggestive of complete hydatidiform mole. In all non-pregnant patients, testicular cancer, ovarian cancer, bladder cancer, and other malignancies should be evaluated as a source of persistent positive hcg testing. The serum test also has some limitations. false positive can occur in certain conditions like ectopic production of hcg in hydatidiform mole choriocarcinoma, germ cell tumor, in addition to multiple myeloma, stomach, liver, lung, bladder, pancreatic, breast, colon, cervical, and endometrial cancers. Presence of heterophile antibodies. They are autoantibodies and antibodies formed after exposure to animal products that interact with assay antibodies. Third is rheumatoid factors. They can bind the antibodies in the assays as well. Fourth is IgA deficiency. Fifth is chronic renal failure or patient on hemodialysis. Red blood cell or plasma transfusion of the blood with hcg in it have been reported to give a false positive result. And last is exogenous hcg preparation for weight loss, for assisted reproduction and doping. In certain conditions, false negative result can also appear. They are early measurement after conception and the hook effect. This effect can occur when hcg levels are about 5 lakh milli-international unit per ml. This is because there are so many hcg molecules that they saturate both the tracer and the antibodies separately, which does not allow for the sandwiching of the tracer hcg antibody required for the measurement. This means that all of the complexes are washed away, giving a false negative result. If gestational trophoblastic disease is suspected, the lab should perform a dilution prior to direct testing. So this is in short about beta-hcg. Hope you like it. And these are the references for this video. Thank you. See you in the next video. Bye.